right. Hello, everyone. My name is Sonia Basseroy, and I'm here with Aisha Chowdhury. Aisha is a British Asian award-winning author, advocate, and coach known for her powerful work in raising awareness about organ donation. Her memoir, Family Matters, shares her family's emotional journey with kidney failure that her mother lived with. Today, we will be discussing organ donations and her book, which highlights the urgent need for more donors. Welcome, Aisha. It's a
Hello,
pleasure to have you here. So
thank
let's
you.
let's start with you telling us a little more about yourself and your caregiving journey.
Okay, well, my name is Aisha. I'm British, but I live in Berlin, Germany, because, well, who wouldn't? It's such a wonderful city. I lived in the UK where I grew up until my mid-30s. And, well, from the age of 15 until 25, my mother needed a kidney transplant. So actually, the four children that she had, of which I am one, along with my twin sister, a younger brother, and an older brother, we looked after my parents, specifically my mother, because she wasn't well, and did what we could when the nurses obviously had to do something more important, they would. But in the meantime, we looked after her because it was not a difficult journey, but we embraced it and we tried to do the best that we could, which is probably what most children would do to their ability to try to keep the family happy and going.
Right, exactly. I think that's everyone here. All of our caregivers and Daisy daughters. We're just trying to work with what we have, and that's it's important to know that that's great that you actually got to work with your siblings. There are a lot of I hear a lot from other caregivers where siblings are not quite in the picture. There's always just one that takes on the full responsibility. So that's wonderful to hear that you all work together to care for your mom.
It literally just made me think. So this is the book I wrote called Family Matters, and that's the picture of my mum at the front where she's 18 and did katak dancing. But
Oh,
to what you
wow.
just said, Sonia, literally the first words I wrote is I was raised in a household where young girls were treated the same way as their brothers. We were, because we grew up with a very strong-willed mother, and she wanted all four of us children to be treated equally and to be as independent as with each other. So it wasn't like you're the boys, you do this, you're the girls, you do that. She saw us as all as one and the same. So if we went to weddings, as often Asians do, it's usually the girls that get up and help. But with our siblings, my brothers, they were also helping, and some of the other cousins who were guys would say, what was going on?" But I felt really proud because there was never this differentiation of you're the girls and you're the boys. So I think her attitude towards life helped set me up with the right mindset of how to be respectful and kind. And it doesn't matter who you are, what your background is, or where you come from.
That's wonderful. She sounds like an amazing woman. Okay, well, let's start off. Let's talk about what the barriers do you believe prevent South Asian communities from embracing organ donation, and how are you addressing them?
It's a good question, actually. I think we all know there are lots of barriers that we face being Desi daughters anyway, right? I mean, we do, it doesn't matter where in the world we are, we look up and we think, why me? But we also often are not alone. So whether we're talking to other friends who are also girls, we know that there's always someone we can talk to. But with the topic of organs, organ donation, it is a difficult one when it comes to discussing it in the South Asian communities. And what I've seen is, honestly, in the South Asian communities, I think people generally feel uncomfortable. There's like unease discussing this topic. And it's often, dare I say it, I will say it, because of religious and cultural beliefs. And that is because they're often misunderstood. Which is a big shame because it just takes some conversation to try to get through to people. And what you find, what I've learned actually by researching a lot and talking to people all over the world, is it's really down to misinformation. So if you talk to people, it often isn't really a religious thing that stops people from considering the idea of being an organ donor, which is to, when you die, or even as a living donor, to help someone live after they've died, to give them that gift of life. It's usually not a religious thing, it's like a cultural thing, which I find quite shocking, but that seems to be the thing, which is people often say, well, because of where we are living, we don't want people to donate, they should be buried whole. So it just leads me to think we just need to have conversations to get people talking, and then the whole cultural misbeliefs and religious barriers won't be misunderstood. We can try to overcome them and get people to be more open about, how easy it is to consider being an organ donor if it's something that people are willing to think about. You just have to open their eyes to the idea of it. So that's the first thing. I also think there's like a lingering kind of mistrust of the healthcare professionals, which has been rooted in past scandals, if I was to be honest. So that certainly existed from what I learned about people from the communities in the US, from the minority communities, from the Black and Asian communities, where medical tests were done on people without their permission. In the UK, there was mistrust because some scandals involved children's organs being used without the permission of the parents. And in Germany, where I'm living, people are often hearing that in order to get a donor, an organ donor, maybe a liver, you just have to slip some money and pay the doctor who's going to bump you up the list. It doesn't work like that with kidneys, but it does lead to mistrust because people think, well, why should I donate if you're not even going to be honest about what's going to happen with me, my organ? I've lived a whole life honestly, and I don't feel comfortable with this. So, of course, people have mistrust. And then it makes them hesitant to want to engage within the organ donation system. So I try to overcome that by talking to people. You were asking about barriers. Language language. I mean, I grew up in a house where my mother spoke Arabic and Urdu and Punjabi. My father spoke Urdu and Punjabi. I spoke English. But when I think about the aunties that we would visit, some of them didn't go to work and they just spoke Urdu or Punjabi or even Hindi. And that meant that if you think about this, when someone goes to a doctor and wants to ask them a question, they don't know what they're asking because they don't understand English. And that sounds really kind of harsh, but unfortunately, that's the experience I've heard about. And I'm pretty certain it's not just in England. I can imagine it's across in the US as well. So a lot of the people in our communities just don't speak English fluently. And that makes it even harder to talk about sensitive topics like this. And that's why I'm translating my book into Arabic. That's been done. Urdu or Hindi. I think Hindi is probably going to be where it goes because most people seem it's like a more familiar language than Urdu, and it's also quite hard to get it translated to Urdu. But what I would like to do is translate it into these languages so that people can actually understand what the topic is that I'm talking about and then consider organ donation and how they might consider what that means for them in their lives if they're impacted by themselves needing an organ, or if they see someone in their family that also needs one, then they can kind of have a conversation and know what they're talking about because it's in a language that they understand. Because often if you go to the healthcare professionals, they speak English, but really it's good if you have people who can speak other languages too. Just makes it easier, puts us all at ease. I live in Germany. I'm British. I was born in the UK. Obviously, I grew up in a household where my family spoke Arabic or doing Punjabi and English. But now I'm living in Germany. I had to learn the language. And once you realize you can understand, you can engage and participate more. Makes the world of a difference to everyone. So that's it. I'm just trying to turn up and speak at events and in the media to open up sort of honest conversations that hopefully can lead to life-saving decisions, because what's not to like about that?
Well, it's interesting you say that because I talk about, so I've been in the healthcare, I worked in hospitals for 15 years before I left, and I started a, a, a personal, like a consultancy to work with private practice. So we have the hospital-based doctors who are under some kind of insurance, and then private practice who can be direct pay or work under insurance, but they own their own practice. So being in healthcare, let's say almost 20 years, and also being a caregiver for almost a decade, I would still not myself know even how to um, even have a thought about donation. This is just something that, like you said, we don't really think about, talk about. Um, so that's very interesting. Language is definitely number one. If I I think a couple of weeks ago I had a hospice doctor come and visit my mom, and I started telling her, what's going on about certain like symptoms and how I'm managing it. And she asked, "Do you have a clinical background?" I said, "No, I've just learned to speak doctor." Because
Mm,
as much as they want to speak to you and explain things to you, they don't use it in simple terms. They don't talk in simple terms, and it's nothing against them. That's their training. But if it was just my parents, they would not understand even probably 90% of what was going on, or questions to ask. They have no idea. They're from the silent generation. They don't advocate for themselves. They don't, explain things. My mom plays things down like everything's perfect, hunky dory. And I have to step in. So thank you for bringing that up. That's very important. So let's talk a little bit about your personal experience and, how your mother's illness shaped um, the advocacy you now, do for kidney donation.
okay, so it's a difficult question, but I think it's important and needs to be discussed. So thank you for asking it. I think no one can really relate to the topic of organ donation unless they either are going through it themselves or they know someone who needs help. And when I say donation, organ donation, you have organ donation, you have blood donation. Everyone knows how to give blood, or the idea of it is like, yeah, I know what that is. Organ donation is consider your organs. And if you can donate those once you've died, then there's stem cell donation, which is like blood cancer. It's so easy to get help to donate your stem cell. It really is. There's so many things. There are 7 organs that you can have in your body to help someone else live on after you've died. Apart from your kidneys, where you can actually donate those while you're alive because you only need 1 to survive. Why were we given 2? Uh-huh. Uh-huh. Question. So if my mother hadn't have experienced kidney failure, then I wouldn't have gone through knowing what it was like for her to wait for an organ transplant, which kind of meant back then waiting for someone to die in order for her to live. But because she came from a South Asian background, it's actually harder to find a match because you're not just looking for someone with the right blood group, you're looking for someone with the right tissue type. And that's different to other organs where you really don't have to go into so much detail, like with the makeup of the person and the organ. It's a lot easier to find or to be able to donate, but the number of people who are willing to do it isn't that high. So if my mother hadn't have had kidney failure, I probably wouldn't be as passionate in advocating and trying to campaign about the topic as I am now. And the reason, even though my mother unfortunately passed away, she was on dialysis for 10 years and she always wanted us children to live our best lives. And I feel like I know what my purpose is now. So even though she's passed away, her entire illness, the 10 years that she spent waiting for a kidney, made us very strong children. And we were very determined and motivated to keep the morale up and to try to shape some kind of future for our families, our family. And what we didn't realize was that actually at some point it all ends. So even though she died, I feel like my mission really, or my purpose, and I'm happy to say this, is rather than I don't know what I'm doing here, is really to try to raise visibility and awareness about this topic. And by her dying, it's been an impetus to get me to write down what was going on. And that's why I wrote my book, Family Matters, because I thought, well, it is a family matter. She was diagnosed with kidney disease. She spent 10 years suffering, and it's a family matter. You don't want to talk about it to others. But it's ultimately like she didn't get the transplant that she could have gotten. She could have had a different life. She may never have passed away. I don't know. But what I do know, and I'm very acutely aware of, is the age she was when she passed away, which is 50, is the age I'm going to be very soon. And I'm proud that I've written the book so I can tell the stories and get people to think about having a conversation with their family. And just talk to 3 people before you go to bed tonight or tomorrow, before the weekend, and just talk about that topic. So then at least I feel like proud that I'm doing something, even though she's not here anymore because she died. That's what you kind of do is I spent her time watching her go through dialysis and see the toll it took on her, because anyone who's got an illness, suffers. And even though people say, oh, she's not around now, she's not suffering, and you're not suffering either, this is true. But wouldn't it be great if everybody had less to suffer in the future, in the world that we're living now? Because we can do something about that. And that's by talking, by me talking to this audience here of Desi daughters. We are the ones that have the voice, that want to, have the capability to speak up and give that message across. So it's that sort of experience with what happened with my mum that fuels my mission to try to raise awareness about kidney donation, because I don't want other families, none of you, I don't want any of you, we haven't met, but maybe we'll write. I don't want anyone to have to suffer in a silent way like we did, because it was a family matter. We didn't talk about it to others. It was a family matter, which meant at the end of the day, when my mother died, they would have asked us if she'd have been well, they would have said, do you consent to her organs being donated? Then if I wouldn't have known what her wishes are, because that's what happens mostly when you die, the family gets asked, do you consent to organ donation? Then you would never have known that it would have been possible for someone else's life to be saved. So in a way, her illness sent us on a journey, and her death created an impetus for me to kind of campaign and get people to talk about the topic. It feels like the right thing to do, because still the number of people who need a transplant globally is just going up. And the number of people offering to come forward to donate either while they're living or after they've died, the numbers haven't gone up enough. I think in the US, because I did a little bit research on this, the number of the US of donors is a lot higher, but that's probably also because the demographic of the background of people living there is from people who are able to donate, which is predominantly white, and that makes a difference.
Very interesting. So, what role do you believe family and cultural dynamics play in attitude towards organ donation in the South Asian communities?
Well, I think we all know it's about the aunties and the uncles, which is the generation above us that we all say yes to, because to us, they are like our parents. So even if you have an auntie who's not your parent, they treat you as if you're their child. So if you can get that generation to talk, because they're the ones that have the powerful units, they are the ones that bring everyone together. It's those ones, the aunties and uncles, that make the decisions. My mum was someone's auntie, my auntie is someone's auntie, and those are the ones that start a topic of conversation, and they're the ones that you have to get listening, because it's those senior members that we all look up to and we respect. So if we want to change attitudes about organ donation, we need to start with these sort of conversations at home around the dinner table, where someone says, can you pass me the yogurt? And you go, yeah, actually, on that, I just wondered, have you thought about, we just I'm going to put it out there. Have you thought about like organ donation? And not that conversations don't happen around the dinner table, but this is where important conversations start and happen. So I think that this is, if you want to change attitudes, that's kind of the right place to start, because it's an informal setting. And I think food and dinner is a very important thing within the Asian community and the Asian culture anyway. So do it in a place where you can do it after dinner. You don't have to do it during, but I think it's a good place because it's a place that brings everyone together. I really do believe that if respected family members show support for donation, the younger generations would be more likely to follow their lead. Obviously, every parent wants, well, it may not be the case today, but because it might be influencer, but generally I think most Asian parents want their children to become a doctor or a lawyer or an accountant. But if they become a doctor, then they say, I want my son to go out or my daughter to go out and save children, save children, save people. And it's the same mouths that say this to the other aunties in the room that don't agree with organ donation. So they're saying, well, yeah, my son is out there working really hard as a doctor. And then the doctor, that son or daughter, is talking to patients saying, asking them those very questions. Do you consent to organ donation happening? Because you've just lost someone that you cared about. And it's a lot easier to have these conversations, not in the moment where someone's passed away, but beforehand. So it's like, really, if you can get people to speak up and it comes from the generation above, then the generation below is likely to follow lead. That's why I share my story, because I really just want to encourage families to open up and speak honestly about the issue, because I think one conversation could change so many lives. Everyone who's read my book so far has either gone to the organ donor register and registered their wishes and their intent of what they want or what they don't want. I'm not forcing anyone to do anything, but by having this conversation, you're really giving someone an opportunity to think about helping someone, which is basically considering if you want to save a life, because the last place you want to be asked the question of do you consent to someone's organs being donated is when they've just passed away. And it's so raw, because I was there when my mother passed away. I was there with my entire family. It was very, very emotional. Everything is heightened, everything is on edge. You're so full of emotion that we were actually asked the question, because my mother had a rhesus B negative blood group. They said, look, we are giving her blood, she's received 12 units. It's not going to keep her alive if we continue to give her the blood, but would you be okay if we stopped? So in essence, they didn't ask us, would you be okay for your mother to be an organ donor? Because she herself would never have been a match because she was so unwell. But they did say, is it okay if we stop giving blood to her? Because that blood could be helped to save someone else's life. And we all looked at each other together, and we all collectively as a family, my younger brother, my older brother, my twin sister, Ali, Abid, and Isa, my father, Ajaz, we all looked at each other and we just knew what the right answer was. Did I miss it? And my mum and my dad. So me and my dad. So we just looked at each other and all knew it was the right thing to do. But it's not nice being asked that question in that moment where you're watching your loved one slip away. So it's, in my opinion, if you have these conversations earlier about helping to save lives, then it doesn't feel as raw and hard and emotional as when they are literally slipping out of your fingers and you watch the world just be destroyed beneath you. It's just like you feel crushed. You don't want to be asked then.
I think it's just in akin to end of life planning, end of care wishes. We want to have these conversations before, so everything is there and no one has to make a choice. If I think about myself, when my mom was under hospice last year and she was essentially dying, we were asked, my brother and I were asked to make decisions, but we hadn't talked about any of those decisions. So rather than learning on the job, well, I made decisions. I was in total emotional wreck. I made
Mm.
decisions then, which now, if I thought about it now, I might have done something different. So I completely understand what you're saying, and that's very important, is that these conversations need to be had ahead of time. Yeah. So, now I know what you talked about, Black and South Asian communities and disparities. So why do you believe it's critical to increase representation?
When my mother was diagnosed with kidney failure, we didn't realize, because she was South Asian, that it would be harder for her to get an organ. And what I realized from the years that passed, by just looking around and seeing who the patients were and which ones were getting the organs, it wasn't about discrimination because of someone's color, but it just seems that people who are from a South Asian and Black background tend to wait longer for an organ. And they're most likely to need an organ because they usually need one, especially for kidneys, with someone from the same ethnic background for a match. So that's nothing to do with racism or discrimination. It's not. It's literally that if you put a white person's kidney into an Asian, they hopefully it won't get rejected. But if you really want it to thrive in the new place that it's living in someone else's body, it's better if it comes from someone with the same ethnic background. So that's why it's important to try and increase representation. Because, in other words, if we don't, we're just digging a hole for ourselves, because no one's going to help anyone. No one's going to come out better. So if we want to thrive and survive, then we have to increase representation. Despite the fact the number of people who need an organ has gone up, there just is still a huge shortage of donors from people from these communities, which means that they're suffering, not just them, but their families are suffering for longer. And unfortunately, they sometimes die waiting, as was the case with my mother, Answer, who was on dialysis for 10 years. And it was a very difficult time because, as we talked about at the beginning, we were carers for her, and the nurses would come home and do a lot of the work that you just couldn't, because she was on hemodialysis. It's a blood dialysis. So sometimes a valve and an artery is connected, and if it bursts, then there's just blood going everywhere. And we would never be equipped to deal with that sort of thing. So it's like the more representation there is from people from our communities, the better we're going to have a chance of helping ourselves in society as one, as a community or a mixed community, and the less suffering there will be. Um, to know that there's so much inequality because people are not coming forward or don't feel comfortable, it's just really heartbreaking because in the end, time runs out. And I believe that by raising awareness, it does encourage more people to sign up to the organ donor register, to say what their wishes are, to talk to their families. And it makes life easier because you start to close the gap. And then you're also together reducing the inequality to a life-saving form of care. There's so much being done in the medical world out there. The only thing that's stopping progress in some ways are the humans behind it, which is such a shame because we could do so much more to move forward and improve everybody's opportunity of living a good life, or a fair life, an equal chance of life as anyone else. We would all benefit from talking to each other more, and then the chance of inequality and suffering would reduce, and the amount of people living a better, different quality of life would be better.
Well, Aisha, this has been so enlightening. And I think you've really just kind of hit the nail on the head where it's just really important to have these conversations with our families, especially our elders who are kind of culturally and religiously set in one way. And as the younger generation and generations ahead, below us, I think I know a lot of times I've wanted to have certain conversations with my parents and just that fear of, you know, going back to when I was 10 years old. And I feel like I'm that young person again, because I want to have these conversations with my parents. I think we really need to get past that. Um, and then, have these conversations. So I, I would say that I have learned so much about caring as a whole and planning for the future as a caregiver, just planning for the future and having these conversations. And I really appreciate that you can come here and talk about this. And I'm sorry if I didn't say this earlier, but so sorry to hear about your mom. My mom also has kidney disease. She's end stage, but she started when she was 82. She's had diabetes, you know, most of her life or a half of her life, I would say. And that caused her kidneys to decline and a whole host of other things. But by the time she was 82 and end stage, it was even too late to even think about dialysis. So I can't imagine how hard it was for you to go through that. And I'm so sorry about the loss of your mom. But I
Thank you.
appreciate you being here.
Well, thank you so much for the invitation. I've been giving lots of interviews and I received an award in Parliament in 2023 just for the campaigning and advocacy. It's not something normal, but
Wow.
it was full, the room was full of Asian people. And I think your Desi Daughters is the only sort of place that came up that made me feel like close to my mum because we are Desi and we were her daughter, me, my twin and I. So it really means a lot to me that you asked me to be able, or you allowed me
Yeah.
to interviewed. It really means a lot, and I appreciate it very much because in the end, we all come and go. We have a birth date and end date, and the bit in the middle is life. It doesn't matter where in the world we live, but we all can feel connected in some way. You've just told me about your mother, so I wouldn't say I'm sorry she can't have dialysis because somehow I think when you're 82, isn't it wonderful that she's lived the life that she has, and isn't it great that you're still there as her Desi daughter? That's just fantastic. Yeah, I mean, the thing is, that time, at some point, that time will end as we will all like leave this earth. But what you do in between the dash, between the birth date and the end date, that's your life. It's what you're
Right.
doing. So even though my mother passed away and we experienced adversity as a set of children in our family with my dad, Ajaz, it's made me stronger. And I just don't worry. I don't worry about anything anymore because we all have stresses in life, but literally when you watch your loved one passing away, in the well, not the operating theatre, but when they tell you there's nothing more they can do, after you experience that, you just see life differently. You just think, don't worry until you have to, because unless someone's lying on a and you're being told that they're on a hospital bed and you're about to lose them, nothing is as bad as that.
Right.
I
I
hope
agree.
those watching don't have to experience that, but should you have to experience it, see it as a challenge and know that after that, allow yourself at some point in life to have permission to live it because you are living it. And that's a wonderful thing. It is.
Thank you. So before we end, your book is being offered to Daisy Daughters at a discounted price of $15. And we'll have all that information in Circle once we post the interview here on demand. Otherwise, it can be purchased through Barnes and Noble and Walmart for $20. You can also make a donation to the GoFundMe, your GoFundMe, and of $15 and receive the book translated in Hindi, as you said.
Well,
So
to have
that,
to pay for it to get translated.
oh, okay, okay.
But if you, yeah, yeah.
But we'll have all that information in Circle and very shortly. And if anybody has any questions, they can contact us and
Definitely. If
yeah.
anyone has any questions and wants to ask me anything, feel free to reach out. I love talking to strangers.
All right, wonderful. Thank you so much again. It was such a pleasure to meet you, and hopefully we get to talk again soon.
Thanks very much.